the session today is not to go through the survey of the patient survey, just to go through the overall guidelines for administering the survey, so we can ensure a form of common approach, and that will also help us ensure a comparison throughout the LIPS and within LIPS, since we want to make sure that everything is done the same way across all the LIPS. No. Okay, so at any point, if you have any question, just stop us. We're open to any suggestion that you might have. Those were suggestions that were made throughout the cognitive testing from different administrators or different interviewers. And after the session, I'll send you also the link to the interviewer's guide. I'll send you the link also for this presentation. And the new survey is also uploaded to Qualtrics, and we'll upload the Alberta survey hopefully before the end of the day today. So you'll get a chance to test it as soon as possible. Go ahead.
That sounds great. One question about when you upload it, what is the latest we can make changes to the Qualtrics survey? So if there are any issues, what's the latest date that you would need them before us using it on Wednesday?
Well, depending. I think that if we need to do it, then on Tuesday evening it would be the last latest. But I think that Kathy has rights to go and edit the survey, so maybe she could go.
Oh, okay.
Maybe you would have to check with her.
What time is your pop-up on Wednesday?
2 o'clock.
So 2 is far more. It's fine for us.
So it's fine for us. You can send it on Wednesday too if there's anything you want us to do, because at 2 o'clock for you, it's like 4 p.m. in the afternoon for us. So if you send it, in the morning, we can do it. I don't expect anything major from you guys, like big changes last minute. So
it's only about the services that will be offered, probably.
Yeah, maybe that would be it.
And if it's about skipping patterns, we'll try to make it. If it's on Wednesday, but
it should be before that.
Yeah, ideally
next week.
Okay. Yes.
Well, Monday or Tuesday.
Perfect.
The earlier the better for the skipping patterns, because they have to be programmed. But for just minor changes to the questions or reorganization
or things like this, it can be on Wednesday.
Perfect. Thank you so much.
Not a problem. So Christine will start with the presentation, just explaining a little bit what we'll be doing today. And then after, I'll explain a bit of the survey content.
Okay, so really today's training is to make sure we have a common approach, process in administrating the survey. We will highlight specific points of importance in the way we ask questions, and we provide response option when needed. We want to reach a common understanding and agreement on how things will be done, and make sure that everything is clear. There is no questions left on how things will be done or process that needs to be done before meeting your first patient.
So basically, if you have anything you think that might be problematic or we could do better in a better way, or just let us know, and we'll adapt the survey if there's anything you think can be changed.
Okay, and so why is this important? Well, we worked hard to have common questions, so patient experience could be compared within a LIP and across LIPs and countries, and there's need to be no interviewers effect, so no, not too much word added and everything like this. So that's why. So, okay. So So administration of the patient survey. You know that the survey helps us understand the patient's experience and use, and well, all that is in the first paragraph. The survey was designed to be administered orally, in person, or by telephone. And the format that you will receive, the questionnaire, will be in a CATI format, which is computer-assisted telephone interviewing. This is a technique in which the interviewer follows a script provided by a software application. In our case, it's Qualtrics. There is advantages for doing so. Well, it is you don't have to wait for data entry. Everything is compiled, so you get quick interim updates on results, and it has built-in logic, so skipping patterns, everything like that. So you don't have to matter too much about which questions come next. It is already done for you.
It should be already done.
Yeah.
Yes. If you see something that's not fluid, you have to let us know.
Yeah.
At one point.
It's the
other slide.
Other slide. So there are some steps that you will have to do before going in the field. So you'll have to read the entire survey that will be provided to you probably tomorrow. So read all instruction, preambles, questions, everything, and make sure that they are adapted to your local version of the survey. A cognitive test, you have to remind that cognitive tests that we have done and review of the questionnaire were done using all questions and in a generic way, and that removing some questions for local purposes may make some preambles a bit weird and out of context. So you will have to check for that specifically. So the first thing is really to read it for yourself. The second step is try administrating the survey to a colleague or someone else close to you to make sure that everything goes smoothly. Then you will identify with your local research team places where you think the flow of the survey needs adjustment. So for general issue, you will have to advise me, and you can put Sarah in CC too, so we can do the changes. And if it's a general issue, maybe you can suggest. It will be really greatly appreciated if you are making suggestions on how to do or say things. And if it's local adaptation, you will send amendments to me also. So we can modify this in Qualtrics, but you will have first to make sure that there's an agreement within your local team on the words and things that you want me to put in. So it will be the same between all interviewers. And lastly, it is important to keep to the written text. So all preambles and everything that are included in the survey. So it will be delivered in the same way, regardless of the interviewer.
So far, do anybody have any question in regards with what Christine just said?
No, and I think with sticking to the text, I think when we sent you some feedback, Jillian, Kathy, and myself, we included some examples, right? So we can all use consistent examples.
Yes, and we also included more examples at different questions or different time in the survey. So that will also that might also help, and we'll go through some of those at the moment now, just so you can see. What are the different
cases that we
or examples so we'll go through this. First we'll talk about the social vulnerability index. It was a bit modified. Those are a specific question at the end of the survey. It was
on social support. There is one on education, one on language, and one on financial perception.
Exactly. And So you had 3 that were more social demographic, and 3 that were more about family and friend support, that were a bit more touchy, if I could say. So the main goal was just to insert them in a different way so they're easier for the interviewer to ask, because those are really mandatory questions. We do need to ask them. They will help us at one point just to help assess the participants' level of social vulnerability. This will help us at the end of the survey and at the end of the intervention when we do the analysis, just to link it to have those patients receive better care now and how to identify them exactly. So we added preambles in this section that might help just better, soften the question beforehand before we ask them.
But really, they are important. They are making a score. So if one is missing, that is kind of not interesting. We really have to get as much as possible all those answers, because they will really be used in analysis, and if we don't have them, we'll be in trouble of interpretation.
Yes.
So this is the question that we provided feedback on, that we felt uncomfortable asking about. Do you have anyone that supports you?
Yes, exactly.
Basically, wasn't that?
Do you have somebody that can show you love and affection, or do you have somebody that you can freely confide in and talk about yourself?
But maybe we can show them to you at the end of the presentation, so you will see the now how they are ordered, and if it will be maybe easier for you to ask them.
Yes,
but if at a time you feel really, really uncomfortable and you are seeing the person going like crying or something like that, you can stop and just say, okay, that's fine, you don't have to answer. But as much as possible, you have to avoid that, like not going and saying these are crazy questions and I don't want to ask them.
And
we really
and when we did the cognitive testing here with vulnerable populations, vulnerable patients, I think we were more uncomfortable than they were answering, like asking the question. I felt that they were comfortable answering the question. So I think it really depends on the situation, but we won't force people to ask the question if really that does affect the person's.
We don't want to create something bad, but
we just want to make it. We just want to stress the importance of those questions in further analysis. So. Okay, so throughout the survey, you'll see different texts that has been modified. So you have italicized text. You'll have text in brackets. You'll have text in parentheses, and you'll also have some text that specifies to prompt with specific sub-questions the respondent. So I'll walk you through all of those and the meaning of each, and I'll show you examples. And if you have any suggestion, we're open to them. Or questions, don't hesitate to ask. So basically, when you'll see the text that is italicized, that are notes that are meant for the interviewer only. So basically, we don't want you to read those out loud.
There are instructions.
Exactly. As you may see here, you have the question in bold, and then you have some text in italic. And it says, and that will be changed. You won't see use MD visit because that doesn't say anything to anybody unless you do have the
paper version.
Yeah. So basically that will be modified, but this just gives you an idea of you don't need to ask the question if you know that his last visit it has been less than 6 months ago, according to the first question that you ask him, which is in the past 6 months, how many visits have you had with a doctor or nurse in a doctor's office or clinic? Okay, so that's one, and we'll see another example of the italic text in a few minutes. When you see text in brackets, most of the preambles have been modified, so you kind of prompt or you kind of ask question to the participant or the interviewee, and those brackets are just places where we identify specific times where you need to adapt the text during the interview according to the patient's response. So you won't have the opportunity to write down the text. You'll have to remember it, just because it will need to be adapted every time to the person in front of you.
Well, it doesn't need to be adapted, but it helps the patient to answer it.
And it's not complicated.
No.
It's not. For example, this is one of the questions where you have this place and brackets, which is previously followed. The previous question is there a specific place that you usually go when you're sick or need advice about your health? So the person just responded to that question. So instead of just saying, is it easy for you to travel to this place? You can modify it to say, is it easy for you to travel to your doctor's office?
Because usually respondents in the cognitive testing, they were not only saying yes or no, they were saying, yes, my doctor's office. So it's easier for them to answer, is it easy for you to travel to your doctor's office instead of to this place? So that's why we just put this place in brackets. But if you don't know, you can still use this place.
Exactly.
Okay.
Makes sense.
So here I put both of them together, the text in parentheses and the prompts, just because the example contains both, and we also have text which is in italic. So the text, when you see it in parentheses, you need to read it. The text needs to be read by the interviewer, I think. Well, to the interviewee. And it provides more clarity or examples. So for when you see the question, what type of difficulties did you experience? So you would say to the interviewee, these include all difficulties you may have had access to the advice or care you needed, all that is associated with your condition, health issues, or to the health system. So that would be what you need to read. And if it says prompt, we don't expect you to read it right away. It just, if you see that they aren't sure what they should be saying or answering to a specific question, you could just prompt them and ask them, did you have any difficulty contacting a doctor or a place of care? Then you would wait a little bit, experience time delays, any language, transport, or cost issues. So that would be a suggestion that we would make, just to say that some people will answer right away a specific question, and others need to be prompted. So those would be examples that you could give. And you also have text in italic too here, saying that.
Leave a bit of time after mentioning each category and use the box. There will be a box provided, because there are really many answers provided to this question. this question, and there are categories, but sometimes you don't know exactly where to put the answer. So instead of waiting and just telling the people in front of you, the patient, just wait, I don't know where my answer is, you can just put it in the box and come back later just to check the right box.
Yes. So is everything we just showed you clear? And does it make sense too?
Yep.
Yeah. Can you just go back to that other question, Sarah?
The previous.
The one about difficulties. Is that one a list with the boxes? I can't remember off the top of my head.
If that one.
Of the difficulties?
Sorry, I didn't hear you.
Is that question, what type of difficulties did you experience?
Mm-hmm.
A list?
Yes.
Yes. It is.
Right? It's a list with a bunch of boxes.
Yes.
Mhm.
So you just want them to come up with those ideas, right? You don't want to offer those categories to them unless they need them?
Yes, we will be offering them, but you can just ask the question first and wait. Maybe they will have some answers to give to you, and then you just prompt them, offering categories that are written there. And
Okay. I just, like, for some people, they just wouldn't even think about all of the
Yes.
options.
Exactly.
Exactly.
But some of them will mention it to you right away. That even when you start the interview, they'll mention that they had difficulties with transport, for example, getting healthcare. So those are some examples that you can give to them afterwards. When you ask the question, one of the feedback we received when we did the cognitive testing is that going through the list was a bit too long for the person in front of us to answer, and they felt that we could just try to simplify things. So that's a suggestion, that you don't have to ask them or go through the list with them, but just ask them in general what kind of difficulties they experienced.
Do you want to show
Okay.
the Qualtrics form? No, this one?
Oh, that's okay. I remember it. I just was curious as making sure we're not missing.
But if you do it in your context, and it's better with just going through the list, go through the list.
Well, it takes time though,
but
it's easier
Yeah.
just to go with the categories, and I think there will be some answers around that.
basically, when you see what you see below when we say prompt, did you have any difficulty contacting a doctor or place of care? Those are broader categories, and they are linked with, for example, the first four questions or first four responses, and then after the experience time delays, any language transport across tissue, those are blocks of responses. So if you know that that person had transport issues, you could go directly to that kind of box and say, any language transport across tissues, and if it says yes to transport, then you tick transport. So.
Okay. That makes sense.
So.
The checklist.
Yes.
Okay. Just go.
So we'll finish with the kind of the checklist, and the checklist is also explained in the guide. And that's something you already have anyways in your survey for the first action point, which is the patient consent to answer the survey. So basically, if they say yes, you go through the survey. If they say no, that ends the survey for the patient. And we also added the preamble that explains what we mean by primary healthcare, but you'll have to specify. So there's brackets again in the survey and the preamble, and you'll have to specify exactly what we mean by primary healthcare in your specific setting. The brackets are just linked with specific places of care. So for us here in Quebec, we had CLSCs, or we had family medicine practices, which in Alberta might be called just something different. So basically, we just want you to use the usual way of saying things in your own region. And when you also see a specific time reference, you should be able to enter it should be done through the survey the first 6 months, but it's not always done. So when you're talking about in the last 6 months, so we're talking about last April, for example. So just remind the person, and you'll have it also in brackets. Remind the person in front of you the specific month.
Or date when it's for the last 4 weeks. Like if we're the September 29, then just say that means since August 29.
Yeah, so for you guys, it will be September 5th. So thinking about September 5th until today or something like that. So yeah, so basically it's just to remind them of a specific time reference. Or so you don't have to read all the response option for each question. And the guide, we also provide some example of what we mean. For example, if you say to the person, have you seen more than one doctor or nurse in the past 6 months? If the person says yes, then you can say, and the response option were, I've seen one, I've seen 2 to 3, or yes, 4 or more. So if the person says yes, the question, you don't have to go through the list. You just have to say, so would you say it's 2 or 3, or would you say it's 4 or more? So that might also help just to shorten a little bit the time spent on the survey.
We don't want you to, usually you won't have to offer the response option. You just ask the question, wait for an answer, and just, how do you say?
Narrow down the answer. Yeah. So if they say yes or no,
tailor the response option that you will be offering.
Basically, people will go straight to the yes or no answer if you don't provide anything. So once they provide a positive or negative answer, you provide a positive, you provide the choices for your positive answer or the choices for the negative answer. So no, not often, no, never, for example.
So there's another example here, which is asking, during the past 4 weeks, how much did pain interfere with your normal work, including both work outside the home and housework? So you ask it, and if the respondent says, how much did pain? Not really. Then you would have to say, would you say not at all, a little bit, or moderately? So it's easier for them because you don't have to remember the question entirely and then try to remember response options. You just ask a question, so they made up their mind, they answer it, and you just tailor the response
according to what they just said. And we tried that through cognitive testing when we were doing the face-to-face with them, and we thought it was easier with our respondents.
But also between us. If you try it just between you within the team, you will see it's really easier just to think of the question and then just, adjust the response.
Hopefully it makes sense to you guys too. But
yeah, because lots of people would just forget the question because they were focused on the list of responses.
Yeah.
So that's really good.
And it shortens the questionnaire also because it takes less time than offering all options.
Because a lot of the time we had to go and repeat the question, so they could associate a response to that question. But once they said yes,
it's positive. So you just offer the 2 or 3 positive options that you have.
Okay. And then we have identify the main provider responsible for his or her care. That is had to be done at the beginning of the survey, but you really need, and we added a few questions in the preamble to make sure that we can really identify that person, if that person has been seen in primary healthcare, if that person is a nurse, a doctor, a family doctor. We don't want any specialists, but basically we really want to focus on that specific provider, and that really helps once you get a sense of who both of you are talking about with the different questions afterwards. Because I had one with whom I did the cognitive testing, and it was difficult at one point knowing, was he talking about a nurse or a doctor's visit, because he had both.
And switching from a question to another.
Yeah. So we tried to add things at the beginning of the survey to help better identify the provider. But I think for that specific place in the survey, you can go a little bit out of
just try to take the time to identify this person. So really, in cognitive testing, they were saying, yes, this is Dr. I don't know,
whatever
Haggerty, which I usually see in his office. So after that, it is really easier for you. Just think of your doctor that you see in his office, or to Dr. Haggerty. So it is really easier.
Yes, and yes, so that will help. And afterwards, you're like, focus on that main provider for the rest of the survey, unless I say otherwise.
Mm-hmm.
There's also a point here about reading the preambles before a set of questions and make sure that the respondent understand what you just said. So there's not a lot of ways to make sure that he understands, but probably since you're face to face, you'll see it if they don't quite understand. But usually they'll mention it to you, or you can say, is that okay? Do you need more information? Sometimes it's provided too. Identify also when was the last visit with the primary care provider.
There's a section of question about the last visit, and so it is worthy also to take the time just to identify that last visit. It has to be in a primary care setting, so you just need to go and, well, it will be written in the preamble, but it is saying in the doctor's office or clinic. And then when identifying the person, if he says a doctor, you say where is it exactly, so you just can confirm by yourself that it is in primary care. If it is not, you have to go back to the question and ask for the last visit in the doctor's office or clinic.
Yes, because they can get confused if they've seen a nurse for a blood draw, for example, and a doctor's in the clinic, but they saw the nurse last. So you really need to kind of specify with them again. I really want to talk about your visit to a clinic and not a pharmacy or whatever, or hospital. And again, as we also showed earlier, when you see the word prompt, this means that you need to ask more questions to make sure that you covered all possibilities with the person. So usually those are provided, and it helps just to make sure that everybody gives same examples over and over again. So we'll have something that is a bit more similar at the end, but that will ensure a comparison throughout the LIPS and the program. I think it's about it.
We can just maybe show one or two, like the part with the social index question, maybe.
Yeah. So just that's the survey that is available at the moment on Partage. That has been modified, so everything you see in red and brown or different color than black is just the latest changes that we made. So basically, the social vulnerability index question have been merged and mixed together with the other social demographic section. And so we started here with I want you to know, and that was something that came up also with the cognitive testing, is that it's quite a long survey and we're aware of it, but we don't know when it will be ending at one point. So we added here that I want you to know that we're almost done with the survey. I only have a few more questions about you. So we started with the birth date, which is not a social vulnerability index question. But then we move into the
what language?
So what language do you usually speak at home is the, so when you see the G here, it's linked with the social vulnerability index. So were you born in Canada is not a social vulnerability index question. Then you have what is the highest level of education you completed. Then we move on to these next three questions are about support from your family and friends. So we kind of want them to be prepared.
Change the order also.
And we also changed the order, because the love and affection was coming not first, but I think in second.
Yeah, it was.
So basically we added
daily activities and then confide and at last
show love and affection when you need it. So ideally they'll answer to all of them, and the final one is how do you perceive your financial situation, which is easier than the one that was there before, so you don't have to ask that last question anymore. So how do you perceive your financial situation is there. So they've been a little bit modified, and hopefully it will be easier for interviewers to ask those questions. Is there anything else you wanted to add? If you have any questions, also we're here to answer them.
Oh, that's helpful. That's great. Thank you.
Good. So I'll send you an yeah.
Go ahead, Ryan.
What did we say? I know we gave feedback on the preamble at the beginning of the survey. Can you just move to the very beginning?
That's not your preamble, though.
Oh, that's not our preamble. Okay.
This one here? Yeah. No, you have your own specific, and yours is fine. I think, yours is a verbal consent, so everything is there. We already talk about SAGE and everything, so that will be uploaded today to Qualtrics. The one that is on Partage, but a specific. Not a problem. Any other questions?
No, I don't think so.
Okay. I know that you guys will be also testing the survey next week, so if there's anything, probably you'll be working on it until then. So we're making ourselves available to make sure that everything is modified as soon as we can, so it's ready for your pop-up next week. And afterwards, also any feedback that you can provide to better the survey or to make it easier to administer, we're open to them. So
yeah, I'll try and run through it with somebody this weekend, I guess.
Yeah, if you can, that would be great. So and you have the link for the Alberta one also from Qualtrics for the weekend. So that will have something that is a bit more targeted or adjusted to you.